Good evening, everyone. So, we are back again with our Evrox Healthcare live shows as usual. And today, first of all, I would like to wish all of you a very happy new year. And we'll start off with our Evrox Healthcare programs. And we are speaking about a very important aspect today, like the previous episodes of COVID cures that we did. So, today we are going to talk about the oral health, oral and the dental health. So, to start off with, a brief introduction about Evrox Healthcare. As you all know, it's a telemedicine and a telehealth based consultation platform. And we have a various aspect of healthcare like general medicine, mental health, to fitness, and oral and dental hygienes, as well as alternative therapy. So, to start off with, today we have with us two guests, Dr. Chirasree, retired Lieutenant Colonel, Army, dentist, and currently helping veterans under the MOD, and Dr. Monali, who is an MDS pedodontics, and she's currently attached to Apollo Clinic, Kolkata. So, to start off with, I would like to welcome Dr. Chirasree, ma'am. First of all, a very warm welcome to you, ma'am.
Thank you.
Good evening, ma'am. Dr. Monali, as I told you already, she is a MDS pedodontics. So, good evening, Dr. Monali. And I would
Hello,
like to
good evening.
a very warm welcome to both of you. And let's start our program today. Also, my name is Dr. Monalisa Banerjee. I am MDS oral and maxillofacial surgery, and I am currently working in Chittaranjan Cancer Institute, National Cancer Institute. And so let's begin our program today in oral hygiene and oral health. So to start off with, my first question goes to, since it is a dental about oral health we are talking about. So we have never been really. I have seen people that they do not actually think so much about their oral health as much as they look for their other healthcare issues. So to start off with, I would like to start with Dr. Chirasree, ma'am. Ma'am, so to start, what are the key points of oral hygiene according to you?
Now, that is a very pertinent question. Can you hear me? Am I
Yeah, we
audible?
can. Yes,
Okay,
you are audible.
okay. Now, this is a very pertinent question actually, because oral hygiene is very important in maintenance of basic health. Now, if we do not, lack of oral hygiene can actually result, maintaining lack of oral hygiene can result in a lot of acid formation in the mouth and plaque accumulation in the mouth and acid formation in the mouth, which can eventually result in caries of teeth. Now, caries of teeth, which we call daant mein keede lag jana in layman's term. Now, beyond that, this has a very cascading effect because the acid that is formed inside the mouth because of lack of oral hygiene can cause dissolution of the teeth. And once that happens, people suffer from very basic problems like pains and sensitivity and discomfort. Now, this can further result in people not being able to eat properly, and this further results in lack of nutrition, appropriate nutrition. Hence, even this can lead to systemic diseases, which we do not relate to it immediately when any kind of because of lack of oral health. If it manifests into systemic diseases over time because of lack of nutrition, we do not immediately attribute it to dental health, but it can be a cause. So that way, it is actually very important to maintain dental health, oral health.
Yes, so that's a very important thing that ma'am explained right now. Coming to the next question that I would like to ask Dr. Monali regarding this is, Dr. Monali, kindly, you have been attached to the pediatric dentistry. So people actually do not know that there are 9 branches of dentistry that we have. And it's a very specialized field with every specialization itself being a very important thing in itself. So tell us about preventive dentistry.
Everybody knows the age-old proverb that prevention is better than cure. So basically, dentistry itself is not expensive, but if you neglect it for a long time, it becomes expensive because whatever the issue is, it aggravates to a point that costs you a lot of money. Now, preventive dentistry aims to prevent these kinds of lesion or aims to detect dental diseases or dental problems at the very initial or very incipient stages, when they can be addressed in a way that they do not aggravate more. Or, like, specifically, if I talk about for children with preventive dentistry, we would like to prevent any dental diseases, dental caries, cavities, any gum diseases at all by using certain measures. And as we all know that everybody keeps repeating that you should brush daily, you should floss uh, regularly. Okay, these are the things that everybody know. But then there are certain aspects like application of fluoride, using of sealants in which we can seal the deep portions of the tooth in a way that you cannot develop cavities in future. Okay, this is what preventive dentistry is all about. That we want to prevent any kind of dental cavities or dental diseases by taking some preventive measures.
Yes, right. So, as you explained the preventive dentistry, could you also talk about how to take care of a child's dental health? Basically, this is a very common question that we get every time. Like everybody, even if we have a family member also visiting us, they ask us that like दांत में कीड़ा लगा हुआ है, and this how to take care of the child's health and oral health, and when
Yes.
to feed, should they have chocolates or not. So can you just tell us that how to take care of the child's dental health?
So, of course, the most important aspect of for any child is oral hygiene, maintaining oral hygiene. We all know that we have to brush, but the most common questions that parents ask me generally is when to start brushing. So it is very easy. You do not need to remember when to start brushing. As soon as the first tooth erupts, that is when we need to start brushing our child's tooth. Okay, so brush twice daily. What brushes to use? There are specific brushes for specific ages for uh, all children. Children of each age have specific brushes which they can use. Okay, and then there is the amount of toothpaste that children should be using. With the children, we have a lot of junior toothpastes in the market, commercially available. People can use any kind of pediatric formulations for toothpaste. Okay, for to brush the children's teeth. Brushing is the best way that you can take care of your teeth. The next best thing is visiting a dentist regularly, of course, so that they can detect any problems that may go unnoticed for parents. Okay, because I've seen children when they come to me, it has gone beyond the level of my capacity. Like, I cannot help them. I feel bad for them, so I tell them that you should have brought the child to me a little bit earlier. Then I would probably have tried to save the tooth. Okay, so it is very important that brushing, taking a child to the dentist. Apart from all this, the most important thing is a balanced diet. A child's food should contain all kinds of nutrients. A balanced diet, avoid sugars, avoid chocolate, avoid carbohydrates. Uh, we People ask me that should I give chocolates to my child? But chocolates are not the only thing which cause cavities. There are hidden sugars in our food. Uh, there are cereals, there are sugary syrups. Avoiding fruit juices. Instead, they can just go for raw fruits instead of taking fruit juices. That helps a lot. Plus, if your child wants to have some sweet treats, which is permissible for maybe sometimes once a week, you can maybe fix a day for the child. That suppose on a Sunday you might allow your child to have chocolates, or you may allow him or her sugary foods in between meals. Okay, not in between meals, but during the meals, and limit the frequency of these sugary treats.
Actually, you know that it's in India. We have seen that like saving the tooth, as you said, is not a very big deal for the people. They usually come to your clinic. They said that okay, take the tooth out. It's fine. You can always extract it and not save it. So yeah, that is one thing that we should be taking care of for changing in this view of what people have, because extracting a tooth also does have a lot of problem in itself. So I'll come to Dr. Chirasree ma'am for now. Ma'am, there's one more very important question that we all have in our minds right now. Is it safe to visit the dentist clinic during the COVID-19 scare? Because doctors, they also come for home visits, but as dentists, we cannot go for home visit and take care of the dental health. So, is it safe for the people to visit a dentist clinic?
This is a very good question for in the present scenario. Now, there are certain things we call certain methodologies that are called as universal precautions, which are taken while attending to any patient whatsoever, in which we consider that all patients are anticipated to be or expected to be infected, not necessarily with COVID, with anything. So now to not to spread that infection, we already use certain protocols, such as for the basic protocols like wearing of gloves, wearing of masks, sterilization of all equipment, fumigation of the dental office, etc. Now there are lots of other things also. Now in the COVID protocol, many more things have been added. As it is, if we maintain the universal precautions, which most people are doing, luckily, hopefully, and we will definitely avoid the disease in spreading the disease. Secondly, now more things have been added to the existing protocols to be able to prevent the spread of COVID-19 in particular, like use of betadine gargles and betadine swabs. Now, what has happened now? Betadine has a known antiviral effect. So all patients are being told to prior to use to any kind of dental procedure, they are being told to gargle and rinse their mouth with betadine rinses. Also, they are being swabbed in the oral area prior to any oral procedure, so that again the chances of spreading COVID decreases dramatically. In many cases, most of the dentists are also doing the same thing, using betadine for themselves as well, that in the worst case scenario, if they happen to be carriers, unknown asymptomatic carriers, they should not spread it to anybody. Next, of course, the usage of the PPE, the personal protective equipment. Most dentists are adhering to that, and all PPEs are largely being disposed of as biomedical waste. Now, PPE is actually usage of PPE, I have also seen, really helps in preventing the spread of COVID-19 or any infection for that matter. For example, in case any doctor happens to be a carrier, if he or she wears a PPE, the infection actually gets sealed inside that. So there's almost no way that that even a doctor will spread it while using the PPE. Now, next comes some of the equipment that have newly been introduced in many of the dental offices, rather, that something like extraoral vacuum suctions, which suctions out the air inside and any aerosols formed, most of the aerosols formed, so that they do not spread. They are kept very close to the patient's oral cavity, so that most of the aerosols formed are removed from the dental office to the exterior of the building. And also, while usage of equipment is concerned, there has been a minimization of aerosol forming, minimization of usage of aerosol forming equipment like dental drills. There has been a substantial reduction in their usage, but that does not mean they are not being used. Yes, they are being used, they need to be used, but when we use the other precautions also, like betadine gargles, extraoral vacuum suctions, and the universal precautions, then yes, it is definitely safe to go to a dentist. We need not hesitate. And both the patients as well as the dental officers will be safe. And we have hardly heard of any case wherein a patient has actually acquired COVID-19 from a dental office.
Very, very true, ma'am.
Okay.
Absolutely. So I think people they were quite skeptical about visiting a dental clinic. So I hope that you get through the fear of visiting with this. So, ma'am, the next question that we very commonly get from most of the people who are around us is that what is the best way or technique to brush our teeth? And is it necessary to brush the teeth twice, or should we do it more than twice, or less than even once a day? People do brush their teeth most of the time. So, is it fine, or what should be the ideal thing to do in that case?
Okay. The question you were asking me? Okay. Now, when it comes to brushing our teeth, it is definitely very important. It is considered that twice a day is optimum, but more than the number of times, it is what is more important is the technique of brushing. If we brush correctly, even once a day is fine, but yes, brushing at night is more important actually than brushing in the morning, because while brushing if we brush at night, the amount of saliva that is circulated in the mouth decreases, and saliva generally helps in flushing out any debris or unwanted material in the mouth as well. And since at night there is decreased amount of saliva secretion, anything that may be in the mouth will continue to remain there and cause further caries formation. So it is better to, if we are brushing only once, then we should brush preferably at nights. Now, and generally, brushing more than twice is not required unless and until specifically told to do so for any specific reason by your dentist. Now, how to brush the teeth is very important, because when we brush our teeth, we must remember one thing, that we need to change our toothbrush once in 3 months, definitely. It can be less than that also. The duration can be less than that also. But beyond that, we should definitely not use it. Now, when it comes to changing our toothbrush, we need to be we need to preferably see, one thing is when we buy it, we need to see that it's a soft toothbrush, preferably, and not medium or hard, because that will help in maintaining the teeth well for a longer duration. Next, coming to when it comes to brushing your teeth, always remember that while we brush our teeth, preferably the movement of our hands should be in a vertical direction, not in a horizontal direction. A horizontal brushing can lead to further degradation of the teeth and attrition and abrasion of the teeth. Okay, I do not have a model right now with me to be able to demonstrate it, but we must remember that vertical movement of the toothbrush is very important. And like I said, changing and covering every surface. Most of the times we can see the outer surface and we keep brushing and cleaning it, and we cannot see the inner surface as well, the inner sides of both the upper teeth as well as the lower teeth. So we tend to ignore it. And what happens is that more amount of plaque formation, staining of teeth, and accumulation of debris takes place in the inner surfaces. Now we must remember consciously that that we need to brush the inner surfaces and all the surfaces of the teeth. Now beyond that, when we must remember, when we use like I said, when we change our toothbrush once in 3 months, we need to remember that we should not discard a toothbrush only when we feel that when it starts to look as if it is worn out, because it generally starts to wear out much before it is visible to the naked eye. And once it starts to wear itself out, it will affect the tooth adversely. Rather than cleaning the teeth, it will start to affect the tooth surfaces adversely. So changing, because the sizes of these toothbrushes are given, the size of the bristles of the toothbrushes are given by World Health Organization and are at a microscopic level, which are not visible to the naked eye. So once these surfaces wear off, they hurt the teeth surface adversely. So we must remember to change the toothbrush accordingly.
Right. So, yeah, as we are talking about the brushing technique, I think it's very important to go to Dr. Monali right now. Monali, tell
Yeah.
us any specific brushes that are supposed to be used in children, and how about the brushing method? They are different for the children? So please explain it to our viewers that how they are supposed to brush their teeth as well.
Like I already said, that your a parent need to start brushing the child as soon as the first tooth erupts. That is, by the age of generally 6 months, when the front teeth start erupting. So even before that, when a child is teething, children can use a damp, wet, clean, maybe gauze piece or a cloth to clean their baby's mouth after they have fed, after breastfed or bottle fed. Okay, and after that, after the first tooth erupt, you can start using small, soft baby brushes to brush your child's teeth. As the child grows in age, you can change the brushes. Now, for this question, it would be great to have a picture for the kinds of brushes which are available. If the moderator can show us the slides, it would be really great. Can
Right,
we?
right. I would request our moderator actually to kindly show the pictures.
Uh, you can show the
Uh,
fourth slide, maybe.
okay.
You can.
Admin, yeah. Admin, I would request you to kindly show the photographs, please.
Fourth or fifth slide, please. Okay, maybe go to the fifth slide. Yeah, this one. So, in this picture, we can see that there are a variety of brushes which are available for children, right? From which, like, from the age of below 1 year till the age of 3 years, there are various types of brushes which are available. Before the teeth erupts, this is a finger brush which is very commonly available even in India. Okay, for parents to brush their teeth, they can just put it on the tip of their finger and clean their baby's mouth using this finger brush. Okay, it is a very soft, not even like a brush. It is a soft brush. And the second one, we can see various different baby brushes which can be used after the teeth have erupted. Okay, and then a lot of people ask me that when can I? Is it should I give my child electric toothbrushes? And when can I start giving my child electric toothbrushes? Yes, electric toothbrushes are really great, and you can give your child electric toothbrushes, of course, but only after a child has developed the brushing habit. They have established a habit of brushing twice daily. They have the manual dexterity, the habit of holding the brush in their hand, and then the method they have mastered how to brush it. Only then can you give it. And it is very interesting for children to hold a machine kind of a thing and try to brush it. It makes them more motivated to brush their teeth daily, because children do not want to brush their teeth. That is one thing they really really hate to do, brushing the teeth. So you can use interesting brushes. There are some brushes which vibrate just to indicate the amount of time that you need to use your brush. They do not necessarily rotate like electric toothbrushes, but they just indicate they have a timer which goes off after a certain period of time. So these are some interesting things that you can do with your child. You can use these brushes at different ages. And about the method of brushing, as Dr. Chirasree has explained, uh, the way you brush your teeth is the same way you have to teach your child how to brush your teeth. It always has to be from up to down, never this way. It has to be from up to down. But a very simple way in which we can generally teach our children how to brush their teeth is, uh, you know, ask them to make circles with their brushes like this in the air, and then they can just reduce these circles and go this way, small circular strokes inside the mouth. Okay, this way they will just do it up to down, and they'll know what to do. So they have to insert it inside their cheeks and just go circular motions. They have to use circular motions so that all the surfaces, all the edges of the teeth get cleaned, and then the inner surfaces have to be cleaned as well. Just like Dr. Chirasree has explained, that is the proper way of brushing. You can actually use YouTube to find various videos for kids toothbrushing methods, and ask your kids to watch them. So that will motivate them even more, and they leave an impact of it on your child's mind on how to brush correctly.
Very, very true. Actually, we need to find interesting methods for to help the children to brush their teeth. Otherwise, as I remember that as a child myself, I used to hate brushing my teeth. But now I am a dentist. That is a very different uh, aspect. So, okay, now I have a very also important question to address by Dr. Chirasree now. We are talking about brushing all the way. So, how much important is dental flossing? Because we miss out the flossing part. We definitely brushing our teeth is a daily activity, but then flossing is also a very important aspect. So, kindly throw us some light on this as well.
Now, flossing is basically done when food gets stuck in between the teeth. It is a string that is used while to remove any kind of food particles that get stuck in between the teeth and are not reachable by a standard toothbrush. Now, flossing is very important because many times when food particles remain in between the teeth, they are not perceptible to us, but they continue to remain there and which causes they start decomposing and eventually cause caries in the teeth. Now, so flossing is very important. Now, when we floss our teeth, what we have to remember is that we should not snap them past the teeth. We should take them only up to the extent where they reach without any extra effort. Because if we are snapping them past any two teeth, that means we are hurting the teeth again and the gums. Flossing is very important, preferably should be done once a day, and if required, more number of times to prevent any kind of any kind of food, remove any kind of food that may remain lodged within the teeth,
Right.
in between the teeth.
Yes, thank you, ma'am. So now I would like to ask Dr. Manali that some children are born with teeth. So this is a very the very common question what parents ask is it a normal phenomenon that they are born with the teeth, or is it not normal? Are they going to are the teeth going to fall off, or they are going to be there? So please explain us about that.
So, like you said, Dr. Banerjee, true. A lot of children are born with some teeth-like structures. Those are not actually real, actual teeth, but those are some bony structures of some tissues which get accumulated and they become a hard mass and which resemble teeth but are not actually our real teeth. Okay, our real teeth only erupt after almost 6 months of age. So these teeth are the teeth which are present from birth are known as neonatal teeth, as they are not required. They are not used for eating. The child cannot use it for chewing because anyways the child is breastfeeding by then. So what there's an issue which these teeth cause is it causes ulcerations for the child. Okay, there is ulceration on the child's gums, on the child's lips, and it also causes harm or hurts the mother's breast when the child is feeding. And there is a major issue which may occur with these teeth since these teeth do not have a root, they might be mobile. They are movable in the mouth, so they might just get out by themselves and get stuck in a child's throat. That is a very common problem that a lot of people have faced with their children. So it is better to get these teeth out. It does not hurt the baby. It is a very simple procedure. It just needs some local anesthetic spray or gel, and the tooth can be taken out very easily. But that are not your deciduous teeth or your milk teeth, which the child uses to eat later in his or her life. These are just neonatal teeth, which is you may call a developmental anomaly, a developmental problem which occurs. But it is
Yes,
not anything abnormal. There's nothing to worry about if a child has.
absolutely. If a child has a neonatal teeth, you should not be worried about it. Rather, get it out if it's coming on the way. That's it.
Yeah.
So, coming to Dr. Chirasree once more. So, ma'am, since we are discussing about oral hygiene, one more thing is that how bad is smoking or coffee bad for our teeth? and how to prevent the dental staining that is caused. Actually, I would like to add something to this as well, is that smoking is a very carcinogenic agent that causes oral cancer, so people should not smoke on the first place. But yeah, coming to the teeth, ma'am, kindly explain how to prevent the dental staining if a person is a smoker or a coffee drinker.
Okay. Now that this question again we'll come back to the brushing technique, because once we brush our teeth properly, it will definitely remove the stains. Correct brushing and proper usage of the toothbrush, that is within the duration. Like I said, if we use a toothbrush for too long a time, it'll stop cleaning. It'll only start hurting the teeth then adversely. So we need to use the toothbrush only for the optimum duration. And again, proper brushing, that is brushing every tooth surface, both inside and outside, and with vertical motion, not with horizontal motion of the hands. Then we will be able to remove the stains caused by smoking and as well as coffee. Now, coffee drinking does not really hurt the teeth so much, or the oral cavity as such, unless and until we're addicted to it. That is bad for systemic health, otherwise also complete health. Now, when it comes to smoking, we know that we have evidence that it has a very strong correlation with oral cancer. Uh, so we need to avoid it altogether, whether it causes staining of teeth or not. It is actually secondary, because it is not the stains that are harmful. It is the effects of smoking that are harmful, the carcinogenic effects of smoking that are harmful. And we need to, in such cases, we also need to, while we are aware, we become aware of the stains in our mouth, in the teeth, we also, in case anybody who is a smoker, also simultaneously needs to be aware of any kind of patches that may be seen in the rest of the mouth because of smoking, that may turn up because of smoking over a period of time, over a certain duration, which may be cancerous or precancerous.
Yes, very well said. Actually, this is one of a very important aspect that should be discussed in a very elaborate way. That smoking does cause oral cancer. And it has been seen in almost 70 to 80% of the cases that people who are smokers, they actually develop oral cancer. So the content, that the nicotine that the cigarettes have, that basically they cause cancer. So anyway, my next question to you, ma'am, is that what are exactly dental caries? And people have a notion that दांत में कीड़ा लगना, as they say, these are just they do not actually know the what are exactly caries or cavities that they get on the tooth. They are just blackish discoloration or whatever. So kindly explain us, ma'am, that what are exactly the dental caries.
Okay. Dental caries, yes, as far as a layman, in a lay terms, it is called daant mein keeda lagna, like we say in Hindi. Now, like I'll go back to where we began today, that in case we do not maintain adequate oral hygiene, then there can be accumulation of food debris inside the mouth. And once there is accumulation of food debris inside the mouth, we have certain friendly bacteria inside the mouth as well. Now, these start thriving on the food debris that we may leave behind in our mouths and in between the teeth. Once they start thriving on those, they produce acids, and these acids further dissolve the tooth structure, which is a mineralized structure. Once the tooth structure starts dissolving, it is actually akin to a gangrene like situation, because it cannot be it does not come back again. It basically dissolves itself completely altogether. And this is called caries. This is called caries, and the cavitation takes place, and it's called caries. It causes dark stains, black stains. That is the basic color of it, and this is caries, and has to be prevented by maintaining good oral hygiene, and, like Dr. Monali said, usage of fluorides at an early age can substantially decrease caries at an advanced stage. And usage of fluorides at a very young age, I have also seen that with time that such patients are far less susceptible to caries in in adulthood.
Yes. I would like to ask Dr. Monali regarding this, that how does bottle feeding affect a child's dental health? And what do you suggest? Breastfeeding versus bottle feeding? How is it different? And which one is actually good for the child? And when should a mother actually shift a child from breastfeeding to the bottle feeding if it is at all required?
Thank you for the question. This is an incredibly important question, and not many people know of this. Even a lot of parents ask me this. Now, if you ask me which is better, breastfeeding or bottle feeding, my personal opinion will be both are both are bad for your child's teeth. Okay, see, WHO has recommended that breastfeeding should be continued till the age of 6 months. Okay, and then the child is supposed to be introduced to solid foods. So from 6 months till 12 months, till the age of 1 year, the child should be, start, you can start weaning off breastfeeding. And according to the American Academy of Pediatrics, they have said that the bottle feeding or breastfeeding should be completely stopped by the age of 18 months. Okay, 18 months is the maximum time that you should feed your child with bottle. Now, it is safe to say that it is better to stop any kind of feeding by the age of 1 year. Now, the question is why? Why am I saying that? Because by the age of 1 to 1.5 year, most of your child's teeth have started coming. Okay, the front teeth are already there. The back teeth are starting to come very slowly. So what happens is, especially with nighttime feeding, when a child is putting bottle in his mouth during the night and feeding or taking breastfeeds, what happens is the milk that is coming in contact with the surfaces of the teeth now turns into acid. Yeah, because it is staying for a lot of time in the child's mouth, and it turns acidic, and it wears off the child's surfaces of teeth. Basically, this acid is what is causing cavities on your child's teeth. And bottle feeding or breastfeeding for a longer time is one of the major causes of early childhood caries. What is an early childhood caries? That is when a child below the age of 6 year old is having multiple cavities on his milk teeth. Okay, so I have a picture for that also. If the admin can show us the picture, the all the front teeth of your child may get involved. The back teeth on your child may get involved. There may be cavities on multiple surfaces. The child will have pain, he'll have decay, there may be pus accumulation, there will be swelling, a lot of trouble and a lot of morbidity and suffering for your child. Okay, this is how the early childhood caries looks like, and it is in 90% cases a result of bottle feeding, prolonged bottle feeding beyond the age of 1 year or 1.5 years or 2 years age. Or I've seen parents who have told me that the child is breastfed for a long time. Okay, especially nighttime feeding. So these are the teeth with which the milk is coming in contact to, and it is just acting like an acid. So imagine what is happening, what is it doing to your child's teeth. So personally, my opinion would be stopping or weaning your child off bottle or breastfeeds by the age of 1 year. Okay, you can introduce solids by the age of 6 months very slowly, and by 1 year of age you can just stop any kind of feeding. If you're giving any kinds of bottle feeds, it never you should put add sugar to those bottle feeds, because that sugar along with the milk is is the one that is responsible for all this terrible scene that I've just shown you. So never add sugar into the water that the child is sipping from the bottle. That is another reason. Okay, and if you have to give a child some fruit juices or water, just use open cups. Do not use close nipple wala cups or bottles. You can just you can use small cups for babies which are available in the market, and ask them to drink from those cups and not from bottles after the age of 1 year. Okay, after your child is 1 year and above.
Right. So that's a very important information for, I think, the parents. And coming to my next question to Dr. Chirasree in this case is, if a person suffers a toothache at midnight, then what should be done? Because they cannot actually go to a dentist right then, or what should be the measures to at least be comfortable for those for the time being when they are not being able to go somewhere to a dentist or to a doctor. So kindly tell us that what is to be done in those cases.
Okay. There are certain home remedies to actually waive off some amount of, to reduce some amount of acute pain, dental pain, such as one, it's better to not to take medicines because one does not know without the prescription of a doctor, because one does not know what kind of allergies and any medical conditions because one may be having, which or already as somebody may be taking medicines for certain systemic diseases or other problems, medical problems, and on top of that, with dental pain, we undergo self medication without without knowing what we ought to take or not or not take. Then it can create further complications. But yes, there are, so it is best to not to self medicate without a doctor's opinion. Now, next comes, there are certain home remedies which we can use that do alleviate pain or at least reduce it to a certain extent. One of which is for something like warm salt water rinsing and gargling. If we take half a glass of lukewarm water with a pinch of salt, and gargle with it and rinse with it for about a minute or two, that tends to give a lot of relief, because most of the times pain is due to Raji, on a number of occasions, dental pain can be due to food accumulation. And if the food gets removed, then automatically with proper rinsing and gargling with the lukewarm water, also brushing, one can brush as well, brush your teeth as well, so that it removes any kind of accumulated debris, food debris. Now, it is also known that salt water actually has a lot of antiseptic effects. It's a known fact. So that tends to give a lot of relief. Now, another thing that many people use, and it is very helpful also in home remedies, is clove oil, which are readily available in chemist shops. If we use, now, clove has a lot of uh, analgesic effect. That is, it tends to relieve pain. It is a known analgesic, and just a drop of clove oil on the affected tooth can reduce a lot of pain. But preferably do not apply it on the gums, because one gets to get a lot of there's a lot of burning sensation then. But in case of severe burning sensation, if we just wash it off, then also wash it off with rinsing, then also the burning sensation goes down. So these are some of the home remedies that in case of acute pain, brush your teeth, keep the area clean. Secondly, use warm salt water rinsing and gargling. Thirdly, use clove oil. And sometimes in case of dire situations, one can even use desensitizing pastes. They have a lot of analgesic effect and relieve the pain in the area as well. Apply desensitizing paste in that area, or brush your teeth. Apply it and leave it on for 10 minutes and then brush your teeth. Brush it off. Even that can alleviate pain to a great extent.
Okay, I have a quick question from the audience. He's writing, Madam, my name is Satish Kumar, age 37. I have a gap between the front teeth. Can I take treatment to reduce the gap? I think Dr. Chirasree ma'am will be able to answer this. Ma'am, kindly help.
Yes, there is possible. It is possible to reduce the gap between front teeth. Now, it depends upon how much the gap is. Without seeing, it may not be possible to diagnose completely and or give the treatment plan. But yes, there are methodologies. One is that certain aesthetically tooth-colored material can be used on those surfaces to reduce the gap. Secondly, orthodontic treatment is also possible, though the age is a little advanced, but still it is definitely possible to even use orthodontic treatment to reduce that gap. But you will have to consult your dentist to see which is the most effective methodology for you.
Right. My next, there is one more question. Nobunita Bhattacharya is asking, my daughter is 6 year old, no cavity, clean teeth, brushes daily, but every morning she gets bad breath, which is not very normal for a child, I guess. How to go about that? I think Dr. Monali is the best person to answer this. Dr. Monali.
Now, a very common reason for bad breath can be plaque and calculus accumulation. That is, Navonita Bhattacharya, you need to check if your child's teeth are dirty, like if they're yellowish or there's some a layer of food that is accumulated on your child's teeth. That may be a sign that your child is having plaque and calculus in her child's teeth. So that may be the reason for bad breath. Normally, this is what causes bad breath. The treatment for this is a simple scaling, in which an ultrasonic scaler machine is used to clean the surfaces of teeth with water. Okay, so that the plaque layer can go off, and the bacteria which are present in the plaque, which are actually responsible for this bad breath, will not be there anymore. And then your child has to brush very properly, very stringently, and in the proper way. So, I might suggest that you need to observe how your child is brushing. If your child is brushing daily, you need to check the method, the technique, how your daughter is using, in the way how, because most of the children, they just chew the brush and do not really pay attention. And in the morning, she's just 6 year old. She's a very young child, so you cannot expect a lot from such a young child. So you need to observe, and if they're not brushing it properly, like I said, from up to down or in a circular motion, and for at least 3 to 5 minutes duration of time, if your child is not taking that much time to brush his or her teeth, then you need to correct your child. You should show them how they should brush properly. Otherwise, you can just go to the dentist and have their teeth cleaned, and mostly that would solve the problem.
Yes, I think Navanita, I think your query is answered very well by Dr. Monali. Coming to one more question, can we take now? Okay, Kakuli Chaudhuri, she's asking, whenever I take coffee, I suffer from bad breath. Is there any solution to it? I think Dr. Chirasree can answer this.
Okay, when it comes to bad breath, there can be actually, just coming to bad breath first, there can be actually a number of reasons. It may not necessarily be oral. It can even people suffering from systemic problems, medical problems of the chest or stomach, indigestion, and all can also cause bad breath. Now, if it is something to do with coffee, particularly, or any food item, but in particular you are aware of that is causing bad breath, rinse your mouth after that. The best thing to do after intake of any food is to rinse your mouth. And most of the times, most of us unfortunately do not do that. And when any kind of food particle remains inside, even after, then it tends to cause bad breath. Now, even after taking liquid foods, it is best to wash your mouth. That way, any sweeteners that may be present in the coffee and all will also get washed off. Otherwise, they tend to stick to your tooth surfaces and can cause further dissolution of the tooth surfaces and or decay of the teeth and causing bad breath. So best thing is to just rinse your mouth immediately after taking anything, whether liquid foods or solid foods. And also go to your dentist and get it checked, because if you have any other problems that, like if scaling is required, then get it done.
Right. So now let's come back to our question session. We are running short of time as well. So a quick question to Dr. Chirasree now. What is the most effective painkiller for toothache? People have this question is a very common question that we do have. So kindly throw some light on this, ma'am.
Okay, there is no perfect painkiller for toothaches. Completely depends from individual to individual, the quantum, the extent of pain, and one should not, like I've said before, one should not self-medicate, because we are most of us take many different types of medicines and have different medical conditions, and whichever medicine we take may not be compatible with the whichever painkiller we take may not be compatible with our existing medical conditions or medications that we may already be on. But in spite of it, it is true that one of the safest drugs is actually paracetamol, but at the same time, it is not meant for self medication. Here, I need to make it very clear. Though paracetamol is one of the safest painkillers and all, because even things, aspects like pregnancy, lactation, when breastfeeding mothers and all, or any other medical conditions also, we need to be very careful of what drugs we are taking. So please don't take anything without the consent of the doctor.
Yes, I think that kind of a lot like solves a lot of problem if we do not self-medicate. So, coming to my next question to Dr. Monali, let's talk something about the ugly duckling stage, because we have seen that parents are sometimes very bothered about the child's appearance. They say that the tooth are overlapped and they are not looking good on the child. And what to do? What are the supposed treatment that we should do? So, kindly explain the ugly duckling stage and how the child will actually eventually how the phenomenon takes place. I would like Dr. Monali to throw some light on this.
So, like you said, you have actually answered most of that question. Ugly duckling stage is that age in a child when a child is transitioning from his or her milk teeth to permanent teeth. So there are a couple of milk teeth in their mouth, and then there are new permanent teeth which are erupting. From the age of 6 years, the front teeth have started coming. So the incisors come, uh, the very first incisors start coming, and then slowly the back teeth start coming. So in the ugly duckling stage, which is usually from the age of 7 years to 12 years of age, that is when the incisors are present, that is these four front teeth in our mouth are present, and the other back teeth are coming. Usually the canines are coming, this corner tooth is coming. Now when the canines are erupting, that is when they push the incisors apart. Okay, and they create a gap in between the front and the incisors in front. So there's a gap in the teeth, this formation of gaps, and it looks very ugly. All the teeth are spaced. A lot of teeth are protruding. They're proclined outwards. So many parents are concerned that why are my child's teeth looking so ugly, or why is it looking so unruly. Okay, so that is only because the canines are pushing their way into the mouth, and they are pushing these teeth apart. As soon as the canines come into their own place, they occupy their own place, all these permanent teeth will get settled down by themselves. So that happens in 70 to 80% of cases, that it is a self-correcting malocclusion, as we call it, meaning it corrects by itself, it gets resolved by itself. We do not usually have to do much about it. Once the canines have erupted, we need to see whether all the teeth have settled down or not. So if there are gaps in your teeth and your child is between the age of 7 to 12 years of age, chances are that the canines are coming and it is an ugly duckling stage of your child. But then I would say that in a lot of cases, it is not self correcting, and there is a major problem with the bite, or with the joint here, which is called the TM joint, the temporomandibular joint, or there's a skeletal structural uh, deformity, or a different anatomical change which is in the child's face itself, that is causing those kinds of unruly or ugly appearance of the child's teeth. So these need to be addressed, these need to be detected early. Again, there are cross bite, or a single tooth might, the front tooth might be behind the upper front tooth might be behind the lower back tooth, that is called a cross bite. There are many small malocclusions which may develop during this period as well, and it is not necessarily be self-correcting. There are a lot of things that your pediatric dentist, I would suggest take your child to a pediatric dentist. So your pediatric dentist can do some interceptive. They can intercept this this developing malocclusion and take some measures, some simple removable appliances which the child can wear and then put them away into a box and store them. Okay, they can just advise those simple appliances to your child. Or if your child is having some habits, like a very harmful habit that most of the children have is thumb sucking habit. Okay, they have a habit of sucking their thumb. Even I was I can I am guilty of having a thumb sucking habit when I was a child. So most of the children have this thumb sucking habit. It needs to be stopped after a certain period of age. After a certain age, it is a strict no because it affects the teeth, the developing teeth, because teeth are just growing and it pushes them apart, and that is what is causing these gaps and this ugly appearance. So your pediatric dentist can detect these things, whether the child is having a habit, whether there is a skeletal problem, or whether it is it just an ugly duckling stage which can get corrected by itself. So these are the things that your dentist can see and detect and then advise you accordingly. If it is nothing to worry about, if it is just an ugly duckling stage, then he or she will advise you to wait till the canines erupt, and that is till the age of almost 9 to 10 years, and then go forward for with a fixed orthodontic treatment, the braces treatment, if required. Otherwise, they may correct by themselves.
Right. So I think Dr. Monali has very well elaborately explained the process of this ugly duckling stage and how a child and when a child should go for a fixed orthodontic treatment or not to go for an orthodontic treatment at all. So now my next question comes to Dr. Chirasree ma'am. Why do we get ulcers in our mouth and how to treat them if we get an ulcer? How to treat an ulcer?
Okay. Ulcers in the oral cavity are actually very common. There are multiple reasons, many reasons. One of the primary reasons is actually nutritional deficiency, in which there is generally deficiency of vitamin B complex in the in the body, and when we do not take adequate amounts of fruits and vegetables, as may be required by an individual, then one of the foremost symptoms is actually ulcers in the mouth. Secondly, there can be other reasons, like even some kind of trauma, like there may be some sharp teeth and all that can be injuring the oral structures, like the skin inside, the mucosa inside, and or gums even, or even other kinds of trauma, like while eating, like fish bones and chicken bones, etc., can also cause oral ulceration. One of the other reasons that can cause oral ulceration is also stress. Now, all of these have different methods of treatment. For example, in case of nutritional deficiency, to reduce, to prevent oral ulcers in case of nutritional deficiency, we have to supplement with vitamins and improve our dietary intake of vitamins. For that, you may even have to, the individual will need proper dietary counseling, and will completely depend upon, and the diet the person will be prescribed, individual will be prescribed, will depend upon that individual's work output and height, health, etc., and medical conditions also. Because our nutritional requirements are actually based on, it is not something that is one size fits all, wherein we just eat this, where all of us can have the same diet. It's not so. It's somebody whose work has to do more with exertions and more energetic and energetic work output and all, then their nutritional requirements are different. It is completely decided by the individual's health and the individual's work output throughout the day. Now, secondly, in case ulcers are due to stress, then we need to go for psychological counseling if required. And because stress is a very important factor in causing oral
বাবা
ulcers.
চার্জারটা
Then
দাও না
if
চার্জারটা
then if
ও
if, for example, it is due to any kind of trauma, like sharp teeth and also inside the mouth, then the sharpness have to be reduced. Sharpness of that surface has to be reduced. For that, you will need to go to a dentist again. Consult your dentist so that any sharp edges can be removed and the cause of the ulcer can be removed eliminated altogether. So these are the generally these are the maximum causes of major causes of oral ulcers.
So my next question also is related, something related to this. Dr. Chirasree, ma'am, again, what to do if there is bleeding of gums, and why do we get bleeding of gums first in the first place, and how to treat them?
Okay. One of the primary reasons for bleeding of gums is because of accumulation of plaque in the oral cavity in between the teeth, in the gums, in the gums, and primarily the treatment for that is scaling. Scaling, that is cleaning of the teeth. Now, this is the first thing for which first line of treatment of bleeding of gums. Because once we eliminate this, then only, and if there is still persistent bleeding, then other causes like nutritional deficiencies in all can be looked into, can be investigated for.
Am I audible?
Yes.
Okay, so my next question goes to Dr. Dr. Chirasree only. Ma'am, hello.
Yes, I'm here. I can hear you.
I
I
think
can
there
hear
is
you.
a admin. Can you just adjust this? I can't hear. Hello, am I audible now?
Yes.
Yes, you're audible.
Okay, Dr. Chirasree, ma'am, sorry, I just got disconnected probably. My next question to you is that is it bad to do scaling of the teeth?
There's nothing called good or bad about scaling of teeth. It is a treatment. If it is required, and if your dentist suggests that it is required because you have signs and symptoms showing that scaling is required, then yes, it has to be done. But if it is not required, then it will not be recommended for you, and it's not to be done. It is simply a treatment.
Okay, so we have a quick question from Dr. Shamodip today. He is asking that what should be the interval of scaling? How often can we get our scalings done?
Generally you can, I mean, generally we give a gap of 6 months in case scaling has already been done before that, in the past, and otherwise it has to be done as often as required. Like I said, it's a treatment. It has nothing to do with the whether, if it is not required, it is never to be done, and if it is required, it has to be done. Generally at the least we give a gap of 6 months, not more than that, I mean not less than that.
All right. So my next question is to Dr. Monali. It is very similar to a question that we are also having from one of our audiences, Ritu Kharayat. Can natural inward teeth alignment be straightened? I also have a similar question to you. Is that many children complain of gap and overlapping in the teeth? And does every such malocclusion require treatment? And how should it be treated?
I have already elaborated, like I just said, that uh, there has to be a differentiation between ugly duckling stage and an actual malocclusion, which requires treatment. So that can only be done by an orthodontist or a pediatric dentist who is seeing your child. A specialized orthodontist is a specialized dentist who uh, deals with straightening of teeth. Okay, so like Ritu has just asked, whether an inward inclination of your teeth be corrected or not. Yes, whether it can be corrected or not depends on a lot of issues, lot of factors like what your age is, what is the severity of the inclination, okay, and what is the cause or the causative factor behind this inclination, whether it requires any kind of extra interdisciplinary measures other than just simple braces treatment. Okay, so all of this cannot be determined by just, it is not same for all. Probably my tooth is crooked and it requires a different treatment, and yours will require a different treatment. So that is determined by an orthodontist who will take several x-rays, some photographs, the model of your teeth, and calculate the space that is present there. So there are a lot of factors, a lot of measurements, analysis that has to be done, especially on the x-ray. A big x-ray called OPG will be taken for your teeth, and then an assessment can be done, and proper assessment can be done regarding whether your inclination or the malocclusion can be treated or not, and what is the total time that will take to treat that the inclination. But I think most of the orthodontic problems are generally treatable. So if you see an orthodontist, or if you see an orthodontist, you might get an answer to that question, because they can assess it like with all using all these uh, measures, and then tell you exactly. So that answers Mona Lisa, your question as well, that whether an malocclusion that is seen in a child is an ugly duckling stage, or it requires any kind of treatment. Again, you can just observe your child till the age of 9 years of old, after the eruption of till the eruption of canines, and see whether the malocclusion persists even after the canines have come. So that is when you require an orthodontic treatment, or you may just see a pediatric dentist who may assess it and let you know uh, what is exactly that is required at that moment.
Right. So we have one more question. I think this is for Dr. Chirasree. Momita Dashgupta Mullik, she asked, I am having sensitivity and pain in one tooth, which doesn't have any cavity. So I think she requires a diagnosis for this as well as the treatment, ma'am.
Okay, this will one of the reasons that one may have pain and one of the reasons, but there can be many actually reasons that can cause pain and sensitivity in a tooth which does not have any cavity is because when there is wearing off of the tooth, which in technical terms is called attrition or abrasion, basically wearing off of the tooth surface, of the enamel surface. And but to get it diagnosed properly, you will have to go to consult your dentist. And so because wearing off of the tooth can is a degenerational problem that can occur due to aging as well as excessive brush, and causes like excessive brushing also over the years, and normal brushing also over the years does cause some amount of abrasion, and that is wearing off of the enamel surface. But for the exact diagnosis, you will have to go to your doctor, you'll have to go to the dentist.
Yes. So I think, okay, now one more question we have from our admin only, Mr. Shundip Chakrabarty. How important is proper chewing for digestion and metabolism? I think Chirasree ma'am will be able to answer this.
It is very important for proper digestion and metabolism. Proper chewing is very important because digestion actually begins from the oral cavity. As soon as the fruit goes into the oral cavity and one starts chewing, the process of digestion begins both in the mouth as well as the entire digestive system. Now, this is what is one of the big, again coming back to where we began today, that is oral maintenance of oral hygiene. If we do not maintain oral hygiene and we lose our big teeth because of lack of oral hygiene, it can it can result in nutritional deficiencies in future, because we are not able to eat properly and also digest. We will not be able to digest the food properly, adequately as well. So maintaining of oral hygiene, maintaining of oral structures or the teeth per se is very important.
Yes. So yeah, that's a very important thing. Maintaining oral hygiene is very important. Coming to Dr. Monali for this, ideal age for a child to undergo orthodontic treatment, and whenever it is required to fix the braces or alignment of teeth, what should be the ideal age for the child to go to an orthodontist?
I've already answered this question actually. When after the canines have erupted by the age of 9 or 10 years, like earliest by 9 years of age, the canines have started erupting or they have erupted by then. That is when you will actually understand whether your child needs an orthodontic treatment or not. That is when the orthodontist can start doing the treatment properly in a proper way, because an orthodontic treatment requires all or most of the permanent teeth to have erupted, so that they can place their brackets or the wires on the surfaces of teeth. So if your child is having any primary milk teeth which are mobile, the orthodontist cannot place the braces on the surfaces on of the teeth. So if you want your child to undergo an orthodontic treatment very early, that is not possible. That can be only done after generally the canines, after the canines have erupted. So by the age of 9 or 10 years old, you can take your child to for an orthodontic evaluation. For some children, that age may be up to 12 or 13 as well. So that is there is no hard and fast rule that the canines will erupt at 9. Generally we say that you can take your child at 9 to 10 or 11 years old, but again it differs from case to case. We cannot hear you,
I
Dr.
think.
Banerjee.
Okay, am I audible now?
Yes, yes, yes.
Okay, I think we have almost answered all the questions that are asked by most of the people. So now let's address on one more important thing is the RCT treatment. Right now it's a hot cake. It's selling like a hot cake. Like everybody goes to a dentist and they know that okay, I'm getting my RCT done today. So Dr. Chirasree ma'am, kindly explain us about what is root canal treatment and when it is done and the outcome of it.
I think Dr. Chirasree is muted.
Ma'am, you're not audible. Ma'am, you are not audible. Kindly unmute
Ma'am,
yourself. Yeah, now you're audible.
Now, root canal treatment is basically a modality of treatment in which here we consider the tooth has each tooth has three layers: the enamel on top, the dentine in between, and the pulp, which has all the nerve tissues right in the center. Now, when any kind of caries, that is, basically caries, or even for that matter, if the tooth wears off naturally due to aging or excessive brushing, and we wear off the enamel, then we wear off and even the dentine is worn off, followed by, and we reach the pulp, the innermost portion of the tooth. When it becomes visible to the external oral cavity, that is when root canal treatment is required. And only that is in case of deep cavities in which the pulp is removed, the nerves are removed, and the tooth is cleaned a few times, generally 3-4 times, and then resealed back, which means that the functionality of a tooth continues to remain without having to extract it, but generally its sensations are not felt anymore. Within, that is inside the tooth, the sensations are not felt anymore. So that is what is root canal treatment.
Right, ma'am. So now I have a question for Dr. Monali regarding this. Is that what is a root canal treatment in a child, and when is it the same as an older person, or it is different? And then what should be the ideal age if a child has to go root canal treatment? Then can it be done on a deciduous tooth as well?
That is a very interesting question. Yes, a lot of children uh, require root canal treatment, like ma'am said. Whenever the cavity or the decay which is present on the tooth has reached till the pulp, when the pulp gets infected, that is when a tooth requires root canal treatment. Now, children need root canal treatment, yes, but the procedure of root canal treatment in children is slightly different, because for children there's a permanent tooth which is supposed to come after the milk tooth will go off. After the milk tooth is shed, that is when the permanent tooth will come. So generally, the permanent tooth is growing below the milk tooth. In actuality, when the milk tooth is in the mouth, the permanent tooth is growing from beneath. So we cannot. There are some materials which are used in root canal treatment, but that cannot be used in children, and there are slight variations in the actual procedure that is done by us. We use a material that will resorb, that will not, like, in very simple terms, I can explain that these materials are meant not to cause any harm to the permanent tooth that is growing below the milk tooth. Okay, so what happens is, when the pulp of the tooth is infected, there is infection in the pulp, or there is pus accumulation in the primary tooth, the milk tooth. Uh, a root canal treatment, which is in children, which is called pulpectomy. This pulpectomy is performed for a child in the milk tooth in a way that this tooth now acts like just a natural tooth. It was like just like it was before, just like a normal natural tooth. And when the permanent teeth start erupting, the roots of these teeth resorb, or this tooth starts moving, like there's a mobility in this tooth, and the primary tooth will fall off, the milk tooth will fall off, and the permanent or the actual tooth of the child will take its position instead of this milk tooth. So yes, RCTs or pulpectomy can be done and are required in a lot of cases for children, contrary to popular belief. And in most cases nowadays, like as a pediatric dentist, I would not recommend extracting a tooth out, taking out a tooth unless absolutely necessary, unless it is decayed beyond uh, beyond any treatment measures. I always suggest to go for a root canal treatment, because it is very comfortable for the child. It is a painless treatment, as there is an anesthesia is administered. The child does not feel the treatment at all. In most cases, many of my patients just sleep off when the root canal is being done or the pulpectomy is being done, because I have performed treatment, like root canal treatment in kids who are as young as 3 years of age till the age of like 7, 8. So there's no hard and fast rule for the age, but yes, there, like children below 3 years of age are generally uncooperative, because they do not know what is happening around them. They will not sit still on the dental chair. They will not keep their mouths open. They will not listen when I say that you have to keep your mouth open, and I'll use these instruments to perform the treatment. So that is the only reason why we do not perform pulpectomy in children who are very very young. But then again, there are many techniques like sedation and general anesthesia, where these procedures, the child can be sedated or can be put under general anesthesia, and these procedures can be performed for children without them knowing anything whatever is going on. But then again, if the child is too young, none of this is recommended. So if a child is having pain, whatever age he or she is in, and if the child is able to cooperate and sit and follow commands, then a root canal treatment can definitely be done. If not, your pediatric dentist can try modifying the behavior, can try to manage the child, and make him or her understand. And uh, that is the main job of a pediatric dentist, is how to manage a child and make him listen to us while the treatment is being done. So there's no hard and fast rule for the age for pulpectomy. But yes, a root canal treatment is definitely recommended. It is safe. A lot of people ask me, is it safe? It is definitely safe. I do it on a regular basis, on a daily basis in young children's teeth, and it is a good treatment. The child, the tooth is as good as new. He or she can eat and chew anything that they want, and just like a normal natural tooth, the new teeth will take its position without any hassles. So, yes, I would definitely recommend a root canal treatment for a child if required. That is.
Thank you, Dr. Monali. First of all, to end this session today, I would like to thank Dr. Monali and Dr. Chirasree ma'am for addressing everybody's answers so nicely, and all our viewers have whatever questions they had in their mind. I think the doubts have been cleared very, very nicely, and informative session that we had today. Also, the smile is the most attractive feature of a person's face or in overall a person. So we should always keep maintain our smiles, and go visit your dentist whenever required. And thank you everyone for joining us in today. And I would like to again thank both our speakers. And good night everyone. Thank you.
Thank you very much.
Thank
Thank you.
you very much.
Thank you.